Hello, and thank you for joining me today. My name is Penny Bound. I am a key account executive at Dean Health Plan. I appreciate your time and interest in learning more about the network options offered to you through Dean Health Plan by Medica. We have officially entered the 2026 open enrollment season. This year's open enrollment period runs from Monday, October 6th through Friday, October 31st. If you are making any changes to your elections, such as changing your network carrier option, adding or removing dependents, please remember to have those changes submitted by October 31st. The primary focus today will include an overview of the network options offered by Dean Health Plan, changes to your ID cards, changes and enhancements to member services, and a high-level overview of the resources available to you on our dedicated web pages, including where to locate the provider search tools. Dean Health Plan offers a total of 5 different network options. We will review each option separately. When making your enrollment decisions, choose the network option that best meets the needs for yourself and your covered dependents. Regardless of which network option you select, you will always have access to in and out of network providers in the event of an emergency or urgent care needs. In this situation, you should always go to the closest facility. The Dean Health Plan HMO network spans across the 20 southwestern Wisconsin counties you see displayed on this map. This option gives you access to more than 8,000 providers and 30 hospitals, featuring the providers of SSM Health. Coverage is restricted to the providers within this network, with the exception of emergency and urgent care. This network option allows you the freedom to self-refer from one in-network provider to another in-network provider without obtaining a referral. The Medica West and Mayo Clinic Health System network spans across the 14 western Wisconsin counties displayed on this map. This option gives you access to more than 9,000 providers and 20 hospitals, featuring the providers of Mayo Clinic Health System. Coverage is restricted to the providers within this network, with the exception of emergency and urgent care. This network option allows you the freedom to self-refer from one in-network provider to another in-network provider without having to obtain a referral. Please note that the Mayo Clinic in Rochester, Minnesota may require an approved referral from your referring provider. This is handled between the providers and not at the health plan. The Prevea 360 East HMO network option spans across the 11 northeastern Wisconsin counties you see displayed on this map. This option gives you access to over 3,000 providers and 12 hospitals. You'll have access to a strong care network featuring high quality care and exceptional patient experience, with access to the HSHS hospitals of St. Vincent and St. Mary's in Green Bay and St. Nicholas in Sheboygan. Coverage is restricted to the providers within this network, with the exception of emergency and urgent care. This network option allows you the freedom to self-refer from one in-network provider to another in-network provider without a referral. The Access Plan Network is a preferred provider organization, also referred to as PPO. This option provides you with nationwide access to thousands of in-network providers across the United States through our contracted First Health PPO network of providers, along with access to the Dean Health Plan HMO network of providers. This option provides you with the best of both worlds by providing you with both in and out of network coverage. Out of network coverage is available worldwide with slightly higher out of pocket cost. Please refer to your schedule of benefits for member cost sharing details. The state maintenance plan, often referred to as SMP, is offered when there are no qualified Tier 1 carrier options within a county. For the state employees, Florence County remains the sole SMP county. For the local employees, there are a total of 48 counties which are reflected on the map shown. Chippewa, Crawford, Eau Claire, Jackson, La Crosse, Monroe, Trempealeau, and Vernon counties were newly added for 2026. Menominee County will no longer be an SMP county in 2026. The network of providers is a combination of the Dean Health Plan HMO and First Health PPO providers located within the designated SMP counties. When access to care is not available within your county, you may seek services with a Dean Health Plan HMO provider or First Health PPO provider from a neighboring county. For example, if you lived in Jefferson County and needed a transplant, you would be referred to UW Health in Dane County, which is not an SMP county. We also recognize the rural areas in northern Wisconsin have limited access to care and therefore have also included SMP providers in 4 Michigan counties and 3 Minnesota counties bordering Wisconsin. Those counties are listed in the upper left corner. For 2026, everyone will receive new ID cards. The ID cards will have a new look to them. If you are enrolled in the HDHP plan, you will notice an increase to the deductible. The new deductible will be $1,700 individual, $3,400 family. If you are enrolled in one of the non-HDHP options, you will notice an increase to the maximum out of pocket. The new maximum out of pocket will be $10,500 individual, $20,300 family. Due to the comprehensive nature of your benefits, it is very unlikely any member would ever reach this limit. We have upgraded our claims and enrollment platform. This will result in the assignment of a new member ID, group number, and payer ID. Any existing medical authorizations will carry forward to your new member ID. Please be sure to present your new ID card to your providers to avoid any delays in the processing of your claims. Shown here are sample copies of what the new ID cards will look like for members enrolled in either Dean Health Plan, Medica West and Mayo Clinic Health System, or the Prevea 360 East network options. The policy ID card is in the upper left corner under the payer ID number. Current ID cards have historically assigned the policy holder as O1. The new format will assign the policyholder as 00. The current ID cards list the product type, such as HMO, and the network options separately. The new ID cards will have combined this into one section highlighted in these examples. Shown here are sample copies of the Access and SMP ID cards. Their format follows the HMO ID cards apart from the inclusion of the First Health Network logo displayed on the front of the ID card. This is present to reflect the PPO network as your primary network of providers. Shown here is a sample of what the ID cards will look like for Medicare split family contracts. Historically, all covered members were reflected on a single source ID card with benefit details listed under each member. The new ID cards will separate the family members by Medicare Prime versus non-Medicare members. While 2 separate ID cards will be issued, they will arrive together in the same envelope and will be issued under the same policy ID. Effective with your 2026 enrollment, we are proud to announce that you will now have dedicated phone numbers for member services. The new phone number for members enrolled with Dean Health Plan, Medica West, and Mayo Clinic Health System, the Access Plan, or SMP, is 877-371-6762. The new number for members enrolled with Prevea 360 East is 877-371-6772. You will find your new number on the back of your ID card. We have expanded our hours of operation to better serve your needs. Representatives will be available to take your calls from 7 a.m. until 8 p.m. Monday through Friday and 9 a.m. till 3 p.m. on Saturday. Please note that member services will be closed on Thursday mornings from 8 a.m. to 9 a.m. The member portals will have a new look and feel. You will continue to access the portals at the same location by using deancare.com/account or prevea360.com/account, and you will use the same username and password to log in. We have 2 dedicated web pages to help you find answers to all your questions. Members enrolled in Dean Health Plan by Medica, Medica West, and Mayo Clinic Health System, Access Plan, or the SMP plan can access the dedicated web page by going to deancare.com/WI-employees. Prevea 360 East members should use prevea360.com/WI-employees. Both pages are similarly designed and provide an overview of the network options with a link to the plan books that provide additional detail. Under the coverage details section, you will find direct links to the decision guides, uniform certificates of coverage for both medical and pharmacy, the schedule of benefits, and the summary of benefits and coverage. Under the providers and information section, you will find direct links to the online provider search tools, printable provider directories, and service area maps. Under the resources section, you will find direct links to FAQs, the Wisconsin Department of Employee Trust Funds webpage, Contact Us, which is an electronic means of reaching out to member services, advanced care planning resources and information, and the nurse advice line. If you have questions, please reach out to member services or visit our dedicated web pages to view the various resources available to you. And again, thank you for your time and interest.